Number 2, immune modulators, checkpoint inhibitors and vaccines. Checkpoint inhibitors are intravenous immunomodulators that can effectively block the action of those proteins that act as brakes or checkpoints on immune cells. Once freed by these special checkpoint inhibitors, certain white cells of the immune system, the killer T cells, are now able to carry out their lethal attacks on cancer cells. This immunotherapy drug class is stirring excitement, not only because of significant long-term cancer remissions, but because of the novel way the drugs work, by augmenting immune responders and/or removing an immune system brake that cancer cells have cleverly exploited. This unique approach of boosting the body's own defenses is producing stunning results in a variety of cancers, especially when combined with standard anti-cancer therapies. Vaccines are also being tested that generate anti-tumor responses by expanding the population of immune cells capable of killing cancer tumors. This approach is now being tested in numerous clinical trials, and if successful, will allow oncologists to make even more progress against advanced cancer.
Okay, we're down to the runner-up for the most disruptive new innovation in cancer. And to discuss this and tell us whether these checkpoint inhibitors can live up to their current enormous expectations in transferring cancer care, we have Dr. Nina Chiocca from the Brigham and Women's Hospital Department of Surgery. He is the Cushing Professor of Surgery and the Neurosurgeon in Chief at the Brigham.
Thank you so much, Monica. There's no doubt that this is a disruptive technology. You only need to go to any one of our scientific conferences, including this one, to see that over half the sessions are dedicated to immuno-oncology. And this is really a novel development in that sense. The holy grail of cancer care has been, can we vaccinate you against cancer so that you will never get it again? That's been a holy grail that we've not been able to fulfill, but now it seems that there are technologies and new medicines and new understanding of pathways are getting us closer to this aspect. Everybody's excited about two potential technologies because of the enormous and great results we've had with patients. One has been the CAR T-cell approach, and the other one has been the disruption of immune checkpoint signaling that allows cancer cells to evade your immune system. The FDA is approving and has approved several drugs that do that. However, I must caution that we are excited, but there's still a lot that we don't know. And so, for example, not all patients, in fact, the majority of patients in some of our clinical trials still do not respond to these therapies. There are still some cancers that seem to be impervious to these therapies, and therefore there's still a lot of research that needs to be done. And this research, I bet, will be around the area of other ways in which cancer cells are immune evading. We know that that is true. It is, yes. Do we have the appropriate drugs and the appropriate combinations to interrogate each one of these cancers and now they're evading the immune system? And finally, what are the new areas of research that will allow us to really evolutionarily figure out how the cancer cells over time is evading the immune system?